All right, so it looks like we've got a good quorum of folks here. Thanks for joining us. I am going to turn it over to Joy to introduce our conversation tonight.
Good evening and welcome. I'm Joy Marie Smith with the Waitsburg Commercial Club and wonderful Walkable. Our conversation tonight is about our children, and it's about the format of their next year, their next educational year. We'll have an opportunity to discuss how families are going to manage a non-traditional learning model. And I have faith in this process, and I have faith, the utmost confidence and faith in our parents and our schools. Waitsburg and Dayton have excellent leaders and well-qualified, caring teachers. Our children are in good hands. So with that being said, I'd like to introduce Jacqueline Lonnie. And Jacqueline is part of a collective impact group from United Way of Blue Mountain. And she, in conjunction with the Community Council, have put together a group that will address equities and balance and opportunity in our educational system, because that's what drives economic development. It's one of my legs that I use to promote Waitsburg, what a good educational system we have in Dayton and Waitsburg. We're award-winning schools and award-winning teachers and again, qualified leaders. So Jacqueline, it's up to you.
Up to me, hopefully not up to me to solve all of this, but I will certainly introduce the conversation a little further. Thank you so much, Joy. I am Jacqueline, and I am the Collective Impact Coordinator at United Way, which essentially means that I help to facilitate the work of the Educational Attainment Alliance. And many of the folks who are serving as panelists tonight sit on the steering committee for the Educational Attainment Alliance. We are a group that strives to improve educational outcomes really from cradle through career. So from our very youngest at birth all the way through what we hope is meaningful and gainful employment that really creates a diverse and thriving economy for our region. So we, as a group, an Educational Attainment Alliance, our steering committee, our leadership has been grappling with these very questions of how are we going to face and navigate all of the uncertainties that this fall brings, from learning and education to employment to childcare. And tonight, we hope to have that conversation with Dayton and Waitsburg. So we're hoping to accomplish three things. We would like to make sure that the communities of Dayton and Waitsburg hear from leaders the most up-to-date, the most important information. We hope to give folks a chance to ask questions and to share their concerns. And we hope to kind of lay the groundwork for collaborative action, because we know that the only way we're getting through this is together. So we know we aren't going to solve any problems in 90 minutes. Wouldn't it be nice? But we know that in 90 minutes, we probably can't solve it all. What we can do is take that first step towards sharing information and hopefully at least identifying some solutions. So a couple things I want to just remind everyone. We're hearing from leaders tonight in education, in childcare, in government, in economic development, in healthcare. And these folks they've got tough jobs. They've got tough jobs under the best of circumstances, and I think we can probably all agree that these are not the best of circumstances. So they are grappling with questions that don't have easy answers, they don't have obvious answers, and yet they've agreed to be here with you tonight and sit in that uncertainty, knowing that we don't have all of the answers, and their jobs are incredibly, incredibly challenging. So we're very grateful that they're here. And we're also, just acknowledging that each of these panelists is an individual. They are not capable of speaking on behalf of every business in Dayton and Waitsburg, and they're not capable of representing every perspective within their organization. They are one person speaking on behalf of groups, and as such, we want to just honor that they can't get everyone's perspective. But we are very grateful to have them, and really grateful for their leadership and that they're willing to share with us tonight. And kind of the structure of our conversation this evening, we will hear from each of the panelists. We'll give them, 7 or 8 minutes before we start playing the Oscar cue music to move on. And then after we've heard from each of our panelists, we will go to question and answer. And many of you submitted some questions on registration, but we'll also take live question and answer. So you'll see at the bottom of your screen a little Q&A box, and that can be used to submit questions. And those questions come to myself and my Zoom co-conspirator, Catherine Veninga, who's off screen, filtering questions as they come in. And so she'll direct those to me and I will direct them to the panelists. So if you've got questions you'd like us to ask, go ahead and put those in the Q&A box and we will pose the ones that we're seeing a lot. We'll try to get those in first. And in terms of this evening's meeting, we want to recognize that we have a limited amount of time. We're here for 90 minutes, which is already a long Zoom meeting. So we cannot hear from everyone. We wish we could. Everyone who's on the call this evening, panelists and attendees, has a really important role to play in all of this. So our community members are, we know you're holding a piece of this puzzle too. And we would dearly love to hear from everyone, but to the extent that we don't want to be on Zoom all night, we'll hear from our panelists and recognize that this is one conversation of many that we will have going forward. And so we also know not everyone can be here tonight, and we are recording this meeting so it can be shared with your friends and neighbors who aren't able to be here live. And we will also produce a summary report, and that summary report will be shared back to everyone who registered. And we will also share it with our relevant local officials, whether that's our city council members or our state representatives or our senators. We will make sure that those reports get out so that our local concerns are represented well. And with that said, I will introduce our panelists. I will go ahead and give you a list of those panelists even. Let me pull that right up. You know what? I knew we would have at least one technological glitch, and it appears to be on my end. I cannot share that screen right this moment, but I will tell you who we'll hear from instead. So we'll hear from Guy Strout, who's the superintendent of Dayton Public Schools. We'll hear from Mark Pickle, who is the superintendent of Waitsburg Public Schools. We will hear from Jenny Dickinson, who is the director of the Port of Columbia. We will hear from Martha Landman, who is from Columbia County Public Health, as well as Shane McGuire, who is from Columbia County Health System. We'll hear from Chris Ann Christensen, who is the clinical director at Blue Mountain Counseling. And we will hear from Jim Pearson, who is the director of the club in Dayton. I don't think I left anyone out, but if I did, I will get to you in the right order once I can pull up this screen share. But in the meantime, I'm going to turn it over to Superintendent Strout from Dayton Public Schools.
Thank you. I'll go ahead and kick it off. I'm Guy Strout, and Superintendent of Dayton Public Schools, and very blessed and honored to be here and be part of the community. My wife and I moved in early June, across from a hospital. And I get to sit here and work and see Life Flight land once in a while and walk about 2 blocks to school if I want to. So it works out really well. Like I said, my wife and I want to say hello. And I am very honored to be able to say the schools can open on time. We live in the Wright County right now, and we want to continue to live in the Wright County. And also we're going to have all students there all 5 days. Again, we're fortunate to have a school with extra square footage where our average class size is 800 and 900 square feet of classroom. And so we can fit everyone 6 feet apart and still have everyone in school together. We're going to offer both a distance learning option as well as in person. So we have a certain number of situations that the student has an underlying condition, or the parent or grandparent or someone living in the household has an underlying condition. And for those, we offer 100% remote learning for the year. It's going to be a challenge, but what we're up for is we want, if we, for example, we have a second grader with an underlying condition and they can't attend school, when they come back next year as a third grader, we want them right in with their peers. And so that is, that's the goal, and that's the bar we've set for students that are distance learning. We hope to keep the school open, and in that, I would ask that everyone keep wearing their mask and keep socially distanced. You're going to hear the same thing from a number of different presenters. But, for us here in Dayton, if we get 5 or 6 infections, then we have to close the school. And it's just a math problem, and it's nothing more than that. And so we want to keep the infections low and keep our kids in school. I posted a plan on Facebook as well as on our website, and I'm going to update that each Monday. We have a high school schedule being released this Monday and a few other changes. Safety is kind of an ongoing thing. So each Monday I'll release a new copy of the plan, both on our website and Facebook. And on that is going to have my email address as well as my cell phone number. And at any point, if any of you have any questions about any subject at all, you can certainly reach out to me, and I'll spend whatever time needed to try and help you out. We are having registration this week as well as next week. So if you are a parent and listening and you haven't been contacted, I would encourage you to contact both offices are open, the high school, middle school office, as well as the elementary school office. And they can certainly tell you when registration is going to look a little bit different, like everything else looks different. And so we're going by appointment, and we're going, like today was A through D, and we're going a little bit of the alphabet, and we're having it in a multi-purpose room and keeping everyone socially distanced. But registration is going on. And then the last bit that I've been asked quite a bit is sports. There are no sports until December, and Superintendent Pickle and I will kind of talk between now and then, and as we have information, we will share information. But right now, the WIA has postponed all fall sports, and the first sport, if you will, is basketball and wrestling, due to start about mid-December. And if the infection rate is where it is now, is certainly in some of the other places where we play teams, then even that season might be postponed. Football and volleyball are due to start in the spring, and I'm cautiously optimistic on those, as well as our traditional spring sports in May and June of softball and baseball and track and field. So that would be a quick update on Dayton schools. I'll certainly answer any and all questions at the end. And again, reach out to me if I can be of any assistance.
Thanks so much, Guy. We will hear next from Superintendent Pickle in Waitsburg. Mark, you're still on mute.
All right.
There you go.
I do that all the time. So
yeah, that's Zoom for you.
So just want to thank you for inviting me to be a part of this roundtable. And this is going into my second year as superintendent in the Waitsburg School District. And we are very blessed to have a wonderful staff here and wonderful students in a community to work with. And so we are in a very different situation than our neighbors to the east in Dayton, whereby we are part of Walla Walla County, and the infection rates are going in the wrong direction. And so as a result of that, we are going to be starting our school this year remotely. And so the plan is at this point is we are going to be starting remotely beginning September 8th, which is our start date, the original start date. We're going to stay with that. And we will reassess where the county is and where the infection rates are. And those are the things that we're going to be looking at very closely beginning mid-October to see if we are going in the right direction as a county. Then that would release us to be able to maybe come back in sort of at least a hybrid schedule. We're not blessed with large classrooms in Waitsburg. A lot of our class sizes at the high school level are less than 500 square feet. So we are forced to do a hybrid 8B type of a schedule. And that's what we were originally going to be starting with until things started happening in Walla Walla County. So we will be we're finalizing our high school, middle school, high school schedules, and those will be released next Monday. And we also are going to be registering our middle school students beginning next week, grades 6 through 8. And that information will be coming out later on tonight or tomorrow. And our high school registration is going to be the week of the 24th of August. And so all that information has been sent out to our families in the community. And during that time, we are hoping that our Chromebooks will be in so that we are going to be one-to-one to start the school year. And at first, as we were going to an A-B schedule, we were going to be 6-12 as a one-to-one for our students to have devices to take home with them. But now, because we're starting remotely, we have expanded that to K-12. And so we will be distributing Chromebooks to our middle school and high school students beginning next week. Hopefully, we're still getting them trickling in from our vendors. And so we're hoping that we're going to get them to everybody by the time school starts. Elementary wise, we are going to do what they call a soft start. And so more information is going to be released as we finalize, but it's going to be something of the nature of holding parent-teacher conferences at the beginning of the school year for about the first week and a half with each of our grade level teachers with their families and their students, because we are starting remotely. The elementary grade levels that are being promoted to the next grade won't have a chance to meet their teachers. And so we're going to approach it this way as a parent-teacher conference. And so we're going to be inviting them in to visit with the teacher, meet the teacher, and get orientated with Chromebooks and with what the learning management system is going to be, get their workbooks and get everything that they need to be able to start the school year as best as possible. And so along with Guy, we are working very closely with as a combine to figure out sports, but for this fall, we are not going to be holding any sports, as Guy mentioned, and looking to winter. We'll wait and see how the rates are going, and if we're going in the right direction, to see if we're going to be able to do basketball and wrestling. And I too will be able to be around to answer any questions that people might have at the end. So I think it's all I've got.
Thanks. All right, Martha Landman, Public Health, you're up.
Good evening, everybody. This is Martha Landman from Columbia County Public Health. Thank you for inviting me to answer questions and give you some information just about the status of COVID-19 in Columbia County. First, with the numbers, I always start all of my webinars with the numbers that we have today. Total tested 459, positive and recovered 12, positive 0, which means that in the last 14 days, we have not had a positive case in Columbia County. That's really good news. Out of county positive and recovered is 4. Those are people that have tested in Dayton in Columbia County and came up positive and have been connected to a Columbia County case. And so we count them as a cluster, as one of the direct contacts, and we follow those through Columbia County, and that's why we track those as out of county and followed on our website. Negative is 441. We have 1 pending this afternoon, and we have 1 death in our community. And so that 1 death is not included in the positives, or I'm sorry, in the positive and recovered. It's in there. We post this information. We get the tests are all done at the hospital, and they send us the lab reports hopefully in the morning, at least once a day. And then we post this on our website, and we post this on Columbia County Public Health Facebook page every day. Try to do it before noon. And we also send a weekly newsletter with updates on the latest cases so that everybody can keep track and look at that if they want. The other thing that, if we're talking about the schools opening and things like that, the one thing that Dr. Weisman has asked us at DOH, Department of Health has asked us is to watch the risk assessment dashboard on the DOH, the coronavirus.wa.gov website. And if you, it's right on the front page of that. And if you scroll down, it shows all counties, and then you can just choose Columbia County if you want. They say to open school, we need to be, it's as Guy calls it, a math problem. It's 25 over 100,000, which means we can only have a couple of positive cases in Columbia County to stay under the 25. Right now we have no cases and we're at 24. I'm not quite sure why it's at 24, but it's at 24. So we are in the low risk zone. So we are eligible to open school with full attendance because of that. There's a medium risk from 24 to 74, and then a high risk above 74. Now I think these numbers are kind of flexible in our community, just because that's so small of a number of cases. But it also depends on where those cases are. So we can say we have 2 cases, and those 2 cases might be in the community. They might be a husband and wife in the same household, and they might not be connected to any kids at the school. Our number on the website would be 91, so we'd be in the medium to high risk phase, but we wouldn't be connected to the school. So it would be a conversation that we would have. We would have to analyze that and say school can continue because it's not connected to the school. Okay, so it's just going to be on a case by case because we're so small and because the number changes us so dramatically every time. Opening school and closing school and doing that is just going to be on a case by case basis, and really how much that case, the positive test result, COVID case, and direct contacts are connected with the school. You know, obviously if that's a second grader in a classroom or something like that, then we have a different conversation with a guy and see how many direct contacts there is with that person and make a decision based on that. That's kind of what the other thing that the Department of Health and OSPI have come out with their guidelines is they classify an outbreak in the school as 2 positive cases in 2 different classrooms, not connected. So not connected meaning they don't have any brothers and sisters in each other's classrooms. They don't hang out together after school with anybody that's connected. They don't really know each other. So we have a 3rd grader and an 8th grader that just really are not, the families aren't connected and they don't know anything. Then that is what DOH and OSPI have defined as a school guideline as an outbreak. And again, then we just have another conversation of what that means, whether we have to close school, whether that means how many direct contacts there is with those, and you know, follow the numbers as we go down the contact investigation. All contact investigation is done at Columbia County Public Health. We're fortunate. I have 2 nurses on staff. I have 2 nurses as backup nurses that right now are doing contact tracing on weekends. And then I have an additional 2 community members that have also been trained in contact tracing that can help call people and contact trace. If somebody is positive, a direct contact to a positive, they're quarantined for 14 days. So stay at home for 14 days, and we at Public Health call them once a day. So there's a little bit of manpower in getting that information and calling them and asking them not only how they feel, but do they need other services? Do they need groceries? Do they need medical information? We have additional housing for them. If they cannot safely quarantine, a positive case would be called an isolation, and a direct contact is called a quarantine. And if they can't do those things safely in their own home, then we have housing available in our community that we could put, have housing and food available for them so that they could be on recovery and be on quarantine in a safe place. So hopefully that explains a little bit more about kind of how the school link works, and how what we're looking at, what we're having conversations with Guy with as we do this. What can the community do to help us to keep the kids as safe as possible? I think here in September and as we go forward from today, we just have to be really aware. We're really lucky to not have any positive cases for 14 days. Look around our communities, look around the communities that are connected to us, and they are not going back to school. And we want to go back to school and we want to stay in school. So my message is stay close to home. Think about our kids when we're going places. Really be aware of how close you are to people. Wear your masks, wear your masks, wear your masks. And just be really aware of that distance you have so that we can keep everybody safe. Because it only takes one person to go visit an aunt that you might not know is sick, that becomes sick, that your kid then goes to school and goes to grandma's house after school for daycare, and then we have an outbreak in our community and we have people sick. So my message is stay closer to home in September. Let's get school open. Let's see what that looks like. Let's see if we could be successful at this, and then move forward from there. Talking about masks, we have cloth masks available at Public Health. Lots of cloth masks. So I have probably 30,000 in my basement at this time. So don't be afraid to call for masks. Don't be afraid to stop by and grab some masks. We will be giving some masks. I know Guy has masks at the school, but we'll back that up if we need. And we have children's masks on the way from the state of Washington. So we will be getting additional masks for that. We delivered them, have them packaged in a package of 2, so it's a wash mask, wear mask. But if you've worn a mask now for a month or 2 weeks or so, and that mask is starting to feel frayed around the edges or something, don't be afraid to come in and get a couple more masks for you and your family. That's what we're here for. That I would rather have all those masks gone than have masks left and community members not using them. So please encourage that. Any of the masks that we have, we're a little, as I told Jenny, we're a little low on our hand sanitizer. We had 110 liters of hand sanitizer that was donated from a grant that we've been giving out at Public Health. And that is about gone, and we're working on getting another batch, seeing if we can get another batch of that with the grant money. I think that's a lot of information, and I'm glad to answer questions at the end of anything that I might have missed.
Thanks, Martha. All right, Jim Pearson.
Good evening, everybody. I'd like to start by thanking Jacqueline and Catherine for organizing this forum and giving everybody in the communities an opportunity to ask some questions of those of us in the positions that we're in. What I have to say will probably serve as much as a teaching moment for you all as much as anything. What I'd like to do is explain precisely what the club is, a little bit about what the club is not, and what role we are capable of playing in the midst of all of this. So some of you are already familiar with what we are and what we do. Some of you may have heard things in the community, but really when it boils right down to it, the club is a safe place for the community's young people to gather, socialize, and learn in an environment. And we try very hard to have that environment promote self-discovery, social emotional learning, and we try to promote positive adult relationships between our staff and the kids. Our programs, we have learned, have to be very flexible to accommodate for a wide range of ages, learning styles, and all sorts of behaviors. We have kids from as young as kindergarten age, sometimes 4s. If they're enrolled in kindergarten, they are permitted to come, and up to 17, 18-year-olds in high school. Now, typically, high schoolers haven't attended our after-school program, but we've had other opportunities for them to engage with us after hours. We've worked really hard to create a culture of care, understanding, and respect. We operate on a very small budget, and at the moment, this current moment, we have 5 staff members. I am the only full-time staff. 2 of our staff are currently high school students. So we have limited resources, I guess, is the point. In our traditional after-school program, we've had an average of 30 to 40 kids attend on a daily basis. Our membership last year got up near to 200. So we had, a couple hundred members, but an average daily attendance of 30 to 40, which was difficult enough to manage without the added complications that COVID has brought along. So one rumor or misconception that I want to dispel is that the club is childcare. The club is not childcare. It never has been. By definition, we are not childcare. In the eyes of the state of Washington, we are not childcare. We're not legally allowed to provide childcare. What we are is a youth recreation program. And just to kind of hammer that point home, last year during our summer program, we were reported anonymously to the state of Washington for providing unlicensed childcare. And they sent some representatives to do an inspection, and they promptly told us that, no, you are not in fact a child care program. You are a youth recreation program and operating within those bounds. What that means is that we can only accommodate school-age children. We cannot accommodate kids that are not yet enrolled in school. It would also mean if we were to become a licensed child care facility, we would have to make some pretty significant investments in our infrastructure. For example, toilets that are capable of accommodating very young children. And we would have to have staff that have a certain certification that doesn't apply to us currently. Our programs are all completely voluntary. That's another issue, is that nobody is forced to come to the club. It's completely by choice, both, generally a joint decision between parent and child. But that voluntary nature swings both ways. While the kids are not required to come to the club, we are also not required to keep them there if their behavior is such that it's creating an issue and is taking too much of our staff's resources to deal with one child. So the point is that it's under the circumstances, all of these things that I've said would be extremely difficult to try to manage with the additional guidelines and restrictions that are in place. So one of the things we are working on, and we hope to have rolled out by the time Dayton schools begin on the 25th, is a virtual club of sorts. It'll have an online component. It will have an at-home hands-on component. And we're even, discussing literally driving around town, delivering things to kids that are part of the program. And that includes Waitsburg as well. We're looking at various options as far as, STEM activities, arts and crafts activities that can be done at home, and provide an online component that allows the kids to engage with us from a distance. Now, I'm not so naive as to think that this is an ideal setup, because I know it's not. Nothing can substitute for the face-to-face interaction. And we would very much like to have that face-to-face interaction, but under the current circumstances, our board has taken a whole lot into consideration as far as the health of our kids and the health of our staff. And I should mention that we have at least 2 staff members, including myself, who have underlying conditions. So that, of our 5 staff, we've got almost half of it that's at risk. The other issue is that the guidelines would require us to add a whole lot of additional staff. at least double what we currently have. So there's the added issues of finding those people and paying for those people. We don't have money for it, and staff for our program has traditionally been very difficult to find, because those of you that are in education or work with children know that it's not an easy job. It's in the environment in which we work and where we're dealing with a wide age range of children, it's decidedly more difficult than a lot of other situations. So really what the decision came down to with our board was the health and safety of the members and our staff, the tremendous expense, and all of the other various issues that come into play. We have opted to delay our in-person programs until 4 weeks after Dayton schools have started. Now, the good news is that we are a small and nimble organization, and if we get 2 weeks into school and everything looks great, and we've all had a change of heart and decide that maybe it is safe to move forward, we can get our board together and do that in a day's notice. And that's how we intend to do this. This 4-week number is not arbitrary. It is just out of an abundance of caution. It's a number that was motioned and seconded by our board, but it's not set in stone. We fully intend to try to reopen to in-person programs just as soon as everyone is comfortable with doing so, and we have the resources available to make that happen. You know, I really, this is a hard conversation for me to have, and I've had to have it quite a lot lately, but the club is absolutely committed to the youth of our communities, and we're committed in a way that unfortunately doesn't really fit this situation. Our resources don't allow for us to operate in the way that is required in the current situation. So we're going to do what we can, which is what we've done all along. You know, I won't sit here and say it's ideal or that it's what we've wanted, but we've tried our best, and we're continuing to try our best, and I'm thankful that we have the community support that we have, and I'm hopeful that you'll all hang with us, and if you're interested in more information about this virtual club that we're working on, you can visit our website. It's easy to find on a Google search. It's theclubdayton.org. I will be posting information there and on our social media pages, and direct email and whatever, trying to keep the word out as to what we're doing, and in an effort to try to stay connected with the families that we serve. So that's all I've got for you. Thank you very much for your time.
Thanks, Jim. And I just wanted to confirm, you said that program would be open to families in Waitsburg as well, correct?
That is correct. Quite frankly, it's open to anybody who wants it. I mean, we're not going to discriminate based on location, age, whatever. I mean, we had kicked around the idea of limiting the program to K through 5 just for logistical reasons. But as far as this at-home thing is concerned, anybody who wants to participate is more than welcome. The only catch is that you will have to sign up for a membership, which is filling out a simple form, signing a waiver, and paying a $20 fee that lasts for the entire school year. So when we do resume in-person programs, you'll be all set up and ready to go in that regard. There won't be anything additional to do at that point. So the $20 covers the entire year.
Fantastic. Thanks, Jim. Really appreciate it. I'm going to turn it over to Jenny Dickinson at the Port.
Hello, everyone. Thank you for joining us tonight. I'm Jenny Dickinson with the Port of Columbia. For those that don't know, we are a special purpose district government here in Columbia County, and we serve all the citizens of Columbia County. So my work has been pretty bizarre the last few months. I've been helping businesses in Columbia County for about 22 years, and I've never seen anything like this. We've been doing a lot of coordinating, and what I'm most proud of is I'm actually helping businesses with money. I've never seen it before in my career, but we have actually been able to give private businesses grant funds. So we have administered on behalf of the state of Washington one grant program already. We were able to fund 25 businesses, and it was over $150,000. And by the way, 3 daycares were funded in that first round, although one of them Unfortunately, Little Sprouts chose to not take the grant and close. I'll talk about that more in a minute. And we currently have a second grant round open. We have some CARES Act funds from the city of Dayton, about $76,000. We have another round of CARES Act funds coming from the state, $120,000. And we got a private grant from Innovia that we can actually use for some startup funds. And that closes tomorrow, and it's going to be about another $225,000 that's going out. The businesses that we're serving are 10 employees or less with these grant programs, and they are extremely grateful. And I've had many tell me that if they didn't get that little bit of help, they wouldn't have been able to stay open. I guess the good news about being small is that these funds from the state go a lot further in a small community like this. So what our businesses are struggling with now, the grants provide operational support, which is great, but it's difficult. It's difficult in a environment where they're not already having a hard time making money to then have employees who need to miss work because maybe they've been exposed to someone with COVID and they have to wait for test results, or they don't have childcare, which of course this is all about. And I don't really know all the solutions, but I think a lot of it has to do with funds, whether it's money to pay for daycare slots that would just be open in case kids need it or in case employees need it for a short term. Or maybe Shane was talking about odd hours daycare, and I'll let him talk more about that and what the larger employers need. And funding for the employers and the employees, so that if they're missing work, they are kept whole and the employer is kept whole. The unemployment program that just expired was very helpful, and the PPP program that is about to expire was also very helpful. And what we need are more programs that are really looking at this holistically and looking at it in a way that they've never had to look at it before. And I'm hoping that can happen. So regarding daycares, we have 2 existing licensed daycares still in the community, Damaris Daycare and Susan's Home Child Care. I spoke with Damaris Daycare today, and she has actually only had 1 full-time child scheduled for the fall, and that person has pulled out. So her problem is that she doesn't have enough customers. It takes about 5 to make it worth it and about 8 to really pay. To be a licensed daycare is very expensive. And as I mentioned before, Little Sprouts Daycare chose to close. And I talked to her at length about it before she did. And she said that she had lost many of her customers because people were working from home and choosing to take care of their kids at home, either because they were afraid to have their child be in daycare because of COVID, or some people have been using high school kids or other unlicensed daycare methods because apparently restrictions have been kind of relaxed around daycare because of COVID. And so parents are seeking cheaper options. And I actually heard that from 2 daycares, that a lot of their clients are just using family or teenager help. So I guess I don't really know what the answer is, but I know that from a business perspective, it's going to be pretty hard to keep licensed daycares open if they can't, if they don't have customers. And we talked a little bit earlier too, before we let the public in on this call, about maybe coordination is a problem. You know, maybe people don't know there are slots open, or maybe we could have some slots that were prepaid in case somebody just needed it for a couple of weeks. But I think this is a conversation that needs to continue, and maybe there is some nonprofit funding coming from the state. It has not come yet. So the fund that is the grant fund that is providing money for the businesses, they have another one coming for nonprofits. So I'm wondering if we keep our eyes open on that one, and maybe if we have a plan, maybe there could be some funds gathered to help provide better childcare through this pandemic. Finally, I did also wanted to say that I met with another young woman this week who is a certified teacher, and last year had a preschool, a private preschool open called Hogeye Hollow. Her name is Lacey Nichols, and she is planning to reopen that preschool. And then she also would like to provide one-on-one tutoring in the afternoons to kids that need extra assistance. So I think that is an opportunity that maybe we could, if there were kids that can't afford, or parents that can't afford to have their kids receive extra tutoring, but they need it, maybe we could find some funds to help pay for that. And the last thing, I'm going to put our website in the chat, our Port website. We have a newsletter we send out every couple of weeks, and you don't have to be a business to be on the newsletter list. If anybody's interested in joining, just shoot me an email. I'll put my email in here too. And we're happy to visit with anyone about their needs in the community and find out more ways we can help. Thank you.
Jenny, I'm going to save you the time of putting it in the chat. We have the chat disabled, so that's just to kind of maintain focus here, but we will send out a summary report of these events, and I will put Jenny's email address. Jenny always wants emails, so I'll put Jenny's email address, and you can go ahead and sign up for that newsletter with Jenny if that would be useful to you. So thank you so much, Jenny. I'm going to turn things over to Shane with Columbia County Health System.
Situation participating in this roundtable because I've been asked to participate as a large business. Many of you know us as the health system or hospital district. Our type of work is healthcare, and healthcare across many spectrums. It could mean helping support the school nursing program in the Dayton School District. It means supporting speech therapy in Waitsburg. It's supporting the EMS teams, the emergency management teams, and fire district, and with whatever the needs are across the spectrum. We are a very large employer. We're the largest employer in the community. We have 176 full-time equivalents that work here, but actual employee count is over 200. The 200 makes up some part-time and per diem, but it all boils down to 176 full-time equivalents. This is an incredibly innovative time. We spent a lot of time talking about the doom and gloom that COVID has brought upon us, the dark cloud that is COVID. I hear people laughing in the halls calling it the Rona, amongst other things. But the fact is it's been an innovator. It's forced innovation across all of our partners on this roundtable. For us, we went very quickly to launching virtual visits in the clinic, including virtual care for behavioral health specialists. Those are programs that normally take months and months to set at a table and figure out how to deploy. We deployed them in about 3 weeks. It wasn't deployed gracefully, but it was deployed quickly out of necessity because chronic disease doesn't stop for the coronavirus. It kept ticking away. We have launched a lot of home office programs with our employees. We have a number of employees here that aren't involved in direct patient care, that are in more supportive roles or billing roles. All those employees are now working remotely. A couple of them were pregnant mothers, for example, that didn't feel safe coming to work in an environment where sick people come all the time, and some of those sick people inevitably would have the coronavirus. And so we've been able to set up a lot of home offices and been able to maintain productivity. The interesting thing about this is because we didn't furlough. We had no loss of employees. We had no furloughing of employees through this. As a small, nimble health system, we're pretty lean already. We didn't offer a lot of voluntary services. Most of our services were considered essential or emergent. And so we were able to maintain employees across the entire spectrum. Additional supports that are useful. The one thing that we ran up against specifically last year, and I got to tell you, the community really came to bear with a lot of energy and effort, but the childcare without having kids in school was a big factor. We did have the local school district partner with us. They offered their gymnasium to us. We supplied some staff. I think the club supplied some staff. School district supplied staff. And for all healthcare workers in the community, that meant extending beyond just the hospital employees, but anybody that was in healthcare or providing emergency services could drop their child off at that time. And it was very helpful. When we think about it, the employees that cannot work from home, the employees that are hands-on patient care, they're first responders. We call them doctors and nurses, but some people call them mom and dad. So we gotta respect the fact that these are parents, and these parents also have households, and they're struggling to keep those households righted while they're delivering essential services to the community. So very, very helpful. We kind of joke that our health system really is way beyond our health system walls now, and that our school systems and school districts and some of the meetings that we've been able to have with both superintendents have stretched healthcare into those environments on a bigger scale than we ever imagined when we were just talking about immunizations and getting kids into chairs. And so we've appreciated the opportunity to be a consultant. We continue to want to take on that role where necessary and when necessary. And we sort of stand in awe at the amount of innovation all of the institutions have provided in the community on a very fast pace, and highly respectful of the plans that they've come up with. Some of the challenges that we're having is the ever-shifting landscape and sands of how to respond to COVID. We are also a government agency. We're highly regulated. We have multiple agencies that are regulatory agencies over us, including the Centers for Medicare and Medicaid, Department of Health, DSHS for the services we provide, aging and long-term care for services we provide, and they've all got varying levels of requirements to stay opening and functioning during this. It's created a lot of stress within our workforce. Behavioral health has become a concern with the constant stress that's on everybody's plate. Also, to keep people healthy and keep them healthy when they can come home to their children and their families is a high priority for us. And so we've spent a lot of energy on focusing on them as people and individuals, not just employees here at the health system. I think the other thing that makes us a little bit unique is we do represent the government sector of this as well. You know, what things are most urgent in our community. I think Martha said it best with, we may not all agree about the masking, but we do know that there's some sound science behind it, and we do know we have a very vulnerable population here. 28% of our population is over the age of 65. It's been recorded that most people that reach the age of 65 will have at least one underlying health condition, with many in our community having up to 3 and 4 underlying health conditions. I got asked the other day when I was wearing a mask in a convenience store, and they said, let me ask you a question. If you didn't have to, would you wear that? And my response was, yes, because I never know if I'm going to come across someone who has an underlying health condition. And I don't want to be the one responsible for introducing illness or sickness to that individual. And so I do choose to use a mask for that reason. And I know that I'm in a highly vulnerable population. And so I think what's most urgent is people maintaining good distance and being conscientious about their neighbors. We are supporting working families in our community in various ways. We are actually looking at daycare services for specifically healthcare professionals. Our hours don't always line up well with other healthcare agencies. You know, we have people that work across 3 shifts, 7 days a week. Most childcare providers are really focused on more of a 8 to 5 type of scenario. It doesn't always line up. In fact, all of our nurses work 12-hour shifts, and so there's at least portions of the day where they would be struggling with any kind of service-provided childcare. And so we're looking to maybe fill that space or partner with somebody to fill that space. And I think that's the other option here is, as Jenny said, some of the agencies have additional capacity, and maybe we could work with them to come up with a solution to provide extended hours childcare. We are standing by to definitely facilitate the schools this fall. We have a unique position of being a public hospital district that actually spans both Columbia County and Walla Walla County. Our hospital district boundaries stretch into Waitsburg. And so we stand by to support the Waitsburg School District. We know that they have some constraints being tied to Walla Walla. When they are able to open up, we want to be here to provide a safety net consultation and do what we can. We are actively in Dayton with our school nurses, working side by side with those wonderful school team members to try to create the safest environment possible, and also working on contingency plans if outbreaks were to happen. The one thing we've learned about the coronavirus and what we know is its symptoms overlie symptoms for a lot of things. Sniffling, sneezing, sore throat, dry throat, cough. I mean, you can name so many underlying health conditions that meet those symptoms. and an abundance of caution is needed on every level. The constraints we face as we work through these challenges, I think that the regulatory bodies are painting very broad pictures with broad brushes, and they don't always apply to every institution in every case. And so we do struggle, for example, with our long-term care or nursing home, with some of the legislation and regulatory guidance that has been created. We've been very fortunate to keep coronavirus out of our long-term care setting, but it's a very difficult operational environment to be in, with the potential of devastating outbreaks. Over 60% of the deaths in Washington State have happened in nursing homes, and so we recognize that risk. You guys can go to our website. We have a very active Facebook page as well. We're constantly putting education content out there. We have a lot of contact information and a lot of information on the coronavirus with links out to various agencies. We're always happy to answer direct messages into us as well via phone or social media. We really do appreciate this opportunity to talk, and open to questions later.
Thanks so much, Shane.
Thank you.
All right. Closing out our panelist remarks, Chris-Ann Christensen at Blue Mountain Counseling is going to speak a little bit about some of the mental health and behavioral health challenges associated with COVID-19.
Thank you for inviting Blue Mountain Counseling. So some of the questions that were posed to us to answer here were the concerns for young people's mental health right now. And I think that that is essential, especially with school starting back. Some of these answers were also provided by Wayne and Tasha, who are social workers up at Columbia County Health Systems. And some have been pre-existing. We've already seen children with depression and anxiety, some substance abuse and misuse, self-harm, self-injuring, suicidal thoughts. One of the concerns is that families are struggling to function and kids are on the receiving end of that, and that can impact them. Increased somatic complaints, particularly probably in smaller children, more headaches, more stomach aches, sleep difficulties. And maybe you can add this, Jacqueline, on the page, but Department of Health puts out a really good pamphlet or package, and it's Behavioral Health Toolbox for Families. And so they have some great ideas, and it's little kids through teens. And one of the things they talk about, there's 4 key components to teaching resilience in children. The first would be learning to be flexible and adapt to change within the family, strong connections, fostering and maintaining connections with others, feeling a sense of purpose in their life and their days, and then focusing on hope. So a lot of that also carries over to the adults. What we're seeing with adults is the depression, the anxiety. We are seeing some increased substance use, self-medicating behaviors. Parents and families in general are struggling with finances. Now we have these school lists back out, and they can be lengthy as far as what children need to start school. Families are stretched financially, emotionally, mentally. What we want to do there is parents need to remember to do self-care, and that's important. They need to make time for themselves and for their families. We encourage sticking with a routine. Kids need 8 to 10 hours of sleep a night. We need to encourage that and make that happen. We need to limit screen time, TV time, time with the news. Meal times together would be great. And I've always said Dayton is like the perfect community for social distancing because you can get out. We have trails, we have streets, we have bike paths, tennis courts, all of that. The track at the football field would be a great place to walk. And exercise is also key to maintaining your physical and mental health. The vulnerable populations, when I got to that question, I just feel like we're all very vulnerable right now because none of us have experienced this before. And I think there are populations that are more vulnerable. Obviously, the people with, underlying conditions, the elderly, small children. There are also people who, maybe their basic needs aren't being met every day. Transportation, is my understanding, will transport people to essential services, but sometimes people may need to go somewhere that's not deemed essential, and we need to be able to find a way to get them there. older, younger people, those who basically were struggling to make ends meet anyway, and with the club not opening right away, childcare diminishing, those are all just making families more vulnerable. So we just want to encourage, we're open, we're doing mental health, we do substance abuse counseling, we are the crisis responder for the community, and we would love to be more proactive than reactive. So we put a message out on Facebook that if you are feeling overwhelmed, we want to be able to see you. We don't want you to feel like you have to come and enroll and go through that whole process. We just want to be a safe spot for people to come and talk, bring your child, whatever the case may be. Call us if you want to do it over the phone. We're available to help and try and help people navigate these really troubled waters.
Thank you so much, Chris-Ann. I'm going to go ahead and share my screen quickly. Chris-Ann shared with us some key resources that are both local and statewide in terms of supporting behavioral health in these really challenging times. So you'll see on there, we've got Columbia County Hospital District, for instance, Blue Mountain Counseling, where Chris-Ann is, and then some various other community supports. And I know that, most people aren't probably sitting here taking notes and writing down numbers, but I wanted this to be available in the recording. And then we also will share this information out in the summary report of this event. So just a quick feature here, maybe highlighting at the bottom that Washington Listens number, which is a crisis line specifically for Washington. So that's a valuable one to be aware of, and their website, washingtonlistens.org or wallistens.org, is a good resource. So I'm going to stop sharing, and I am going to pose a couple of questions to our panelists, who thank you so much, all of you, for your comments and for sharing. I certainly learned a lot, and really appreciate your leadership and your knowledge, and the fact that you're willing to share it with us so generously. Guy, I want to pose a question to you. We've had several questions from parents about, and Martha may be able to jump in here and support you on this one too, but if a child in Dayton Public Schools tests positive for COVID, what is the plan? And then there have also kind of, in that vein, been some questions about privacy as related to the temperature scanning protocol for students who are coming into school. So I wanted to give you Guy a chance to address that, and then Martha may want to jump in on that one as well.
Yeah, so the first part on the facial recognition, we got 3 machines. One's going to be in the elementary, one in the middle, and one in the high school. And they are kind of brand new, and therefore right now the company has no capability of connecting those machines to the network. I wish they, if they could, it would be more helpful. They are completely at this point standalone. No one can access them, and it would have stored the student's face, which we already have stored in our system, as well as their temperature. As it turns out, it is cumbersome enough that it's a good system to take the temperature, but the process to figure out who has walked past and get a report on that, I can't connect the printer to the system. I can display it, but a very small amount of information, so I have to scroll down. So what we're going to start at this point with, we're going to have 2 people at each station. One person's going to watch the person walk through and verify the temperature, and the second person's going to just have a sheet of every student and click their names off. And that way it'll be an easy way for it to start while we ramp this thing up, of verifying that everyone who is in the school has walked past and got their temperature checked. In terms of the original question on the positive, if a student tests positive, or I'll rephrase it, if a student goes home sick, we're going to strongly encourage them to call their doctor and or public health and get tested. And then really the school district steps out of it, and it becomes a public health issue. And then I simply follow the advice and counsel of Ms. Landman. So I'll kind of let her kind of answer what happens if there is a positive case.
Thank you. What would happen with the positive cases? They would get tested at the hospital. They would call and make an appointment to get tested, and call their primary provider, as Guy said, to see if that's what their provider recommends. And then there's an appointment process to get tested. Those test results would then come to public health. Public health would then call the if this is a second grader or third grader, they're a minor. So public health would then call the parents of the minor and give them and talk to them about the results of the test and start our case investigation of who they have been around in the process of when they felt sick. If they felt sick on a Wednesday and then when they went and got tested on a Friday, we would be asking them who they were around 2 days before they felt sick. So we would be asking them who they were around on Monday and we would be asking the parent a series of questions and sending them a series of questions and possibly an email. And then they would be conversing with their child or letting us talk to the child, depending on whether this is a second grader or a 10th grader, and getting the name and list of contacts that they feel like they've been in contact with for 15 minutes within 6 feet. For over 15 minutes within 6 feet. And then we would take that list. Those people would then be considered direct contacts. And brothers and sisters and everybody in the household would be considered a direct contact. Those people would all be on 14-day quarantine. And then we spread the process out to, classmates if they were within 6 feet for 15 minutes, teachers if they were within 6 feet for 15 minutes, janitors, anybody on the playground in a different classroom. There's a list of, we're putting together lists of different questions for different grades at this time that we think would be beneficial to get us started on the conversation. Did they go to grandma's house after school? A whole myriad of things to try to juggle the memory of where you were 5 days ago and who you were in contact with. And then we would just take that information and continue to process that and keep in touch with Guy on what that looks like as far as people in the school, as far as numbers. HIPAA requires that we don't release any information. But we would be talking numbers and things like that.
Thanks so much, Martha. And I don't want to put you on I know you're juggling a lot of information anyway, so I don't want to put you on the spot for a county you don't represent. But for folks who may be listening from Waitsburg, are you able to talk a little bit about Walla Walla County trends and kind of where they are in terms of going up or going down, and how that relates to the difference in school plans? So with Dayton schools being able to open and Waitsburg schools not yet being able to open, kind of how that relates to trends in Walla Walla?
Yeah, I think we have to go back to the dashboard in Walla Walla and look at the numbers. Their numbers have gone up significantly. They've had an outbreak at the corrections facility, which has really affected their numbers in the last week or so. Unfortunately, the number is what we are asked by Department of Health to watch and to look at and guide. And then the Walla Walla Community of Health over there and the school districts have their conversation. But that's their numbers are continuing to go up and testing. So it's still a concern over there.
Thanks, Martha. All right, I want to direct a question to both superintendents. I know, our current plan is Waitsburg will launch with distance learning and Dayton will go back in person, but of course there is the likelihood that at some point Dayton does go remote. And in the case of remote learning, what supports are available for students who are, from potentially more vulnerable populations or who have higher needs? So our students with special education plans, our students who are maybe learning English as a second language, our students who didn't access distance learning fully in the spring. So those kids who are maybe kind of on our radar, what supports are in place for those students?
I'll go ahead and start, and then Mark can go ahead and finish. In Dayton, it really kind of depends upon what kind of outbreak and how much leverage we have, or guidelines. If we can bring small groups in, which the Department of Health, even in an outbreak, is allowing in certain cases, we'll bring small groups in. At present, middle and high school kids are getting out at 12:30, so we don't have lunch on campus. And then that time from 1 to 2, or potentially 1 to 3, we're bringing in some of those students right now, but in a full distance model. We're going to have a plan in place to give them that extra support. And if we can bring it in-house, we will. If we have to bring it via video, then we'll do that. But we're going to kind of be proactive in terms of saying when we have to leave. That way, it won't be a surprise to anyone, if it does happen.
In Waitsburg, what we are doing is we're working on our plans right now to offer some sort, because we are in phase 2, we're still in phase 2, so we can bring in small groups of students and teachers or para-eds for that extra support. And so I'm working right now with my team to communicate with those families to work out a schedule to bring them onto campus in small groups of two to 3 students at a time. And that's where we're at right now. We haven't finalized the plans, but we've started that process. So that information will be going out very shortly to the families. Our team is working to contact those families beginning next week.
Thanks so much, both of you. And I hate to stay on these school-related questions, but I think those are heavy on folks' mind, especially in the questions we received on registration. And one of those is, there's been a lot of talk in the community about parents shifting to kind of pod their kids or get their kids together to utilize the services of maybe a private tutor or a teacher in the case that school is at a distance, or to employ someone to really kind of help guide kids' learning. And we know certainly that extra support would be beneficial, but what about how do we keep those kinds of supports available to all of our students and not just those who can afford to pay for it? And I'd love to hear from, I think we all have a role to play in this, right? This is not just a school problem. So how maybe are businesses thinking about supporting families with these learning needs? And how can local government think about supporting families with these learning needs so that all of our students really are having access to similar sorts of opportunities and supports? I can play eeny, meeny, miny, mo with our panelists if we need to. Does anyone want to jump in here?
This is Guy. I got kicked off for a second, so I did not hear the question. So if it's directly related to me, if you could re-answer or re-ask it.
Sure. Let me shorten it, Guy. And it is a school-related question. We've heard a lot of talk in the community about parents putting their kids in pods, and this would be under a distance learning model, but kind of getting kids together and then employing a tutor or a teacher to kind of help support and guide those students in their learning. And we've already heard from a number of folks actually leading up to this event about private tutoring services that are being offered and folks wanting to advertise that. And while we can certainly appreciate that those supports would be useful to students who may be at a distance in a distance learning model, it does present an equity challenge. So what kinds of supports can we as a community provide so that all of our children are supported through this time and have access to similar services?
I think from my standpoint in Dayton, it would be matching up the individual students with the individual resources. We can't, as a school district, send staff out to, work in a pod of students at their house necessarily. But we have a variety of expertise and resources we can bring to bear in certain cases, especially if we shut down the school and are in a full distance learning mode for an extended amount of time. My recommendation would be that's something I'll look into. That's something I'll come up with a list of resources, and then if someone wants to reach out to me individually, I'll certainly work on that.
From Waitsburg's standpoint, I'm not as versed. This idea of these pods just started surfacing not too long ago, and so I'm not very familiar with what. I'm really, quite frankly, I'm still trying to figure out how we're going to start school ourselves and all the resources that we need to have on that. But in order to help, if there is going to be something out there like that, then we would be able to kind of follow what Guy was talking about and be able to provide some resources, some online resources. We're going to have, we're putting together some parent and student resources on our website for links to apps that our staff are using with our students, links to a variety of like Khan Academy or to other applications or organizations that will provide some sort of resource for support, for instructional support.
This is Martha, and the one thing as I think about pods, I don't know a lot about them, but I would like to encourage that they also, follow the social distancing, follow the guidelines. One of the things that we're doing at the school a lot, I'm very aware of at the school, is keeping the kids within their grade. So that we don't have a fourth grader mixed in with a second grade class and somehow have an outbreak that does involve that second grade class that then would automatically affect the fourth grade class also. So I'm open to any discussion if people had questions about that side, the social distancing and the keeping in the pods or anything else that DOH is requiring at the school level, if they wanted to see those guidelines to help them set this up safely. The key would be to set the pods up safely as they're doing the learning. Thank you.
Thanks so much, Martha. I really appreciate that reminder to parents that if that was even going to be an option, it would need to be thought of kind of in a similar sense to how we were thinking about schools. I do want to pose a question, and Chrisanne touched on this, and it's come up many, many times in our registration questions as well, is thinking about screen time. And this is a kind of a physical health question and a mental health question and a behavior question. When we've got kids who, whether it's because they're doing distance learning or because they have long stretches of unsupervised time at home, are on screens, kind of what are some of the concerns? And then maybe actually it would be interesting to have Jim jump in here. What are some ideas for non-screen activities that could be kind of incorporated into either our distance learning or our at-home, not quarantine, but our home time that aren't on a screen?
Sure. Well, I mentioned when I was speaking earlier that we were looking at an at-home hands-on component to our virtual club. And along the lines of things that we're thinking about, or I don't know how many of you are familiar with KiwiCo or other companies like that provide like a monthly subscription service, and they provide a STEM or a STEAM activity that a child can do, and it comes with all of the supplies and all of the instructions to do it, and they're relatively simple and they're age appropriate. That's something that we're looking very strongly into as an option of providing as part of our program, not just to keep kids away from screens, but also to try to accommodate those members that we have that may not have the same access to technology as some of the kids that we serve, because not everybody has a computer or internet access, but that's part of the reason why we're going that route. But it's kind of a double-sided deal in that it does promote doing something outside of interacting with a screen.
Thanks for that, Jim. Anybody else want to jump in on the screen question?
Well, Mark, you're always 4 steps ahead of me, but I'm wondering if it would be beneficial for the community to have access to information about how to limit and monitor children's screen time. I know my granddaughter's parents are right on top of that, and I'm always amazed at the tools that are available and that I wasn't aware of. So is there anything like that parents can access on how to limit what children access online?
Are you referring to just screen time, or referring to not accessing certain applications or certain things on the internet? Because when we talk about access, the devices that we'll be checking out are going to be scrubbed, or they call them scrubbed. I'm not quite sure the other term for it. That seems to be the buzzword now. But they will go through and they will image them. And so there'll be certain restrictions that students will not be allowed on certain sites and those kinds of things like that, to the best of our ability to be able to do so. But as far as like screen time with families, there's a website that I commonly refer to whenever I have questions regarding, use of screen time or parent involvement in those kinds of things. It's Common Sense Media. It is a wealth of information when it comes to smart use, digital citizenship, and smart use of screen time. So that's one that I refer to quite a bit. It's Common Sense Media, and it's a really good resource for both parents and students.
Great. I think that helps even me.
Mm-hmm.
Thanks, Mark. I want to make sure Chris-Ann has a chance to touch on this one since she brought it up. Chris-Ann, anything you want to add about concerns around spending extra time on screen time and maybe what can be done about that?
Well, my concern, I think since the kids were let out of school in March, and I speak from experience, my own daughter has become really sophisticated at spending huge amounts of time online, and I'm embarrassed by her screen time numbers every day. But there's a lack of other things to do sometimes. So I understand kids are going to learn via computers, and that to me is a different form of screen time, although I would suggest that be broken up too, because you can't, for those of us who sit at a computer all day, it's mentally and physically exhausting. But there are, and I'm okay with screen time to reduce social isolation and talking with family and friends and stuff like that. But hours and hours of Snapchat and TikTok and games and predators out there. And I think there's a lot of misinformation out there as well. I mean, I would caution adults to limit their screen time and get off some of the news channels, and get some fresh air or pick up a hobby. So it's about balance. I think you need to balance your free time.
Thanks, Chris-Ann. All right, we're getting down to the wire here. We've got 5 minutes, and I want to make sure we've got a pretty pressing question about lunch, and I want to expand that to both school districts. Will food service continue in the event of schools shutting down the way it did in the spring?
Yes.
Yes.
Yes and yes. So
Yes,
students
and
will be
yes.
able to access lunch through the school in the event of a complete or partial shutdown.
Yes, and for Waitsburg, since we are starting remotely, we are going to take a look at utilizing our bus service to deliver meals as we did last spring. That seemed to work out the best for us. And so I'm working with our food service to figure out the details about how we're going to do that. But I think our plan right now, and it could change because as we know, in this day with dealing with what we're dealing with, everything that we plan now is all subject to change, and that's just the way that it is, but we are going to be looking at doing a home delivery service very similar to what we did last spring, and that's how we're going to start our school year. So we'll be working with our families and with our food service to get that set up and get that going.
Thank you both. Guy, there was a question specifically about lunchtime for high schoolers in the Dayton schools. If Dayton high school students, they didn't have lunch on campus, but they chose to stay on campus until 2 p.m. for some of the other options offered after dismissal, what would they do about lunch? Will they be asked to leave? And then would the school provide lunch for high school students who needed it?
Yeah, all high school students will get lunch at 12:30. as we get released. And at the start, it's going to be a grab and go. And then if we can get into more cooking in the future and kind of do that safely, we'd like to. In terms of, we want them to stay on campus. If they are going to be here till 2 o'clock, they stay on campus. If a parent chooses to, they say that my student lives too far away, or they have their younger siblings on the 2 p.m. bus, I want to take the 2 p.m. bus, then they can stay. As well as there's going to be some intervention between 1 and 2. And so if a math teacher and English teacher wants to recommend some students stay after and take the bus, they will also stay on campus. In that case, we're going to be opening up our high school library at 12:30, and students will eat in a socially distanced manner in the high school library at 12:30. And then those that need to stay till 2 and just need a place, then they'll continue to start working in the library. Others might go to individual teachers that they got a request from.
Thanks so much, Guy. And I wanted to just mention a question that was answered offline. Someone inquired whether community members could volunteer to help with deliveries if the club were going to do kind of the distanced model. And Jim said, yes, absolutely. They would love help with those deliveries. And he can be reached at his email or phone number, and we will make sure that that gets out to folks who registered for this webinar, that they can get in touch with Jim if they'd like to help volunteer, get those materials out to students. But we are at time, we're at 7:30, and I just wanted to make sure we thanked again our panelists for participating tonight and sharing their knowledge and their leadership with us. And like I said at the beginning, just being willing to sit in the uncertainty that we're all in right now. And I think Mark put it pretty well here just a couple minutes ago. You know, the best laid plans right now are that's all they are. They're plans, and I'm kind of sitting in that uncertainty and trying to navigate it. And I think our goal for this evening was just to highlight that we can navigate it as a community, and that we'll be better and stronger to the extent that we're able to work together towards solving some of these really, really challenging and critical problems. So thank you everyone who joined us tonight, and thank you to our panelists. And with that, I'm going to go ahead and say farewell. We will make sure that this recording is shareable, and we will also produce a report that we will share back with folks who are on the call.
Thank you.
Thanks so much, everyone.
Thank you.
Thank you, Jacqueline and Catherine.
Thank you, Jenny. Have a good night, everyone.